Well, on Monday's show, we talked about the trend of looks maxing, all the ways people are optimizing their appearance and confidence.
Today, we're continuing that conversation by focusing on the growing number of men turning to cosmetic procedures. We're joined by our friend, Cherry Creek plastic surgeon, Dr. Samir Hasan, also known as Dr. Beauty Blade, to break down some of the most popular options. So are you seeing, I know you've been in this game for a while, more men than usual?
Absolutely. We have seen a surge in the number of male plastic surgery patients and aesthetic patients, especially since COVID. I think everybody's been on their phone. The guys are coming in, their wives, their girlfriends are getting surgery, and then they're bringing the guys in.
Yeah, we just had this conversation and we did see how some people take it to the extreme. Something that I don't know if I can pronounce, but it's gynecomastia.
Yes, gynecomastia.
Gynecomastia.
So,
What is that and what is this concern?
So mast is just breast, chest related. So men, as you can see in this photo, also have breast tissue. It can be hereditary, genetically acquired, or diet most commonly. Chronic alcohol use, certain medications for acne, anti-acid medications can cause that, and there's a treatment for it. So you can get it surgically removed, typically with liposuction, and some guys will take it a step further to get athletic male enhancement of the pec muscles and inject that fat back in to the chest at the muscle level.
I'm not mad at it. I mean, we do things, why can't they?
No, I agree.
Yeah.
Totally. The
sure.
Hercules procedure, I'd never heard of that before. That one seems intense. What's that?
You know, so when we talk about female plastic surgery, we say mommy makeover.
Yep.
So same thing for guys. There is a Hercules procedure where it's just a media term, but basically we're taking fat from areas that are stubborn, that are undesired, the flanks, the waist, putting it into the muscles, bringing out the definition of the abs, the pecs, the deltoids, all those muscles that guys spend hours in the gym to try to build. Sometimes it's better to put fat into those areas or to lipo around them to bring out that definition.
You can like sculpt what you want to look like.
Okay.
Exactly.
What about, you know, I know that a lot of people are doing eyelid, kind of like the eye lift.
Yeah.
How do you do it where, yes, you don't look as tired, but you also don't look like that you're overly done?
Surprise.
Yeah, the surprise look.
Yeah, I don't know if they got a photo they can run, but yes, so eyelids.
Looks great.
Oh, that is good. Wow.
When you see a guy, what's the first thing, guys and girls, the first thing you notice that tells us their energy, their age, it's the eyes.
Totally.
So when you just pull a little bit of that eyelid skin back, it gives them a vibrance, it gives them an awakefulness that you otherwise wouldn't have if you didn't take that skin out. Botox is a way that people non-surgically will lift the brow and open the eyes up, but I love taking a little bit of skin. In office, 30-minute procedure. Folks are getting this done and being back to work within days.
Okay, really quickly, what's the recovery between that before and after?
Yeah, so the recovery there, that's a 1-month follow-up. We barely get to see some of these folks for follow-up, so if I get them in, I take a picture. That is a 6-month post-op. But look at his face, and those things, Face Tight, Morpheus, Lumecca, those are things to improve texture. When you look at their faces, especially the other one, you can kind of see pigment reduction, texture smoothing out from these microneedling treatments that we pair with the eyelid lift.
And people want to know, what does something like that run you? I would imagine it's an awake surgery, so anesthesiologist is always a big part of this. You don't need that, right?
Exactly. These awake surgeries, especially these ones, are anywhere from 5,000 to 10,000, depending how much they do in one setting. And it's great because you're right, they don't have to go to sleep, they don't have to get recovered, and they don't have to have the downtime of major anesthesia.
What about like love handles? Like how quick is that liposuction type of a procedure?
That and the gynecomastia, both of those are typically an hour-and-a-half procedures in office that folks will just do in the afternoon or in the morning and be back to work. It's great for people that don't have major physical demands. Guys, we get, you know, whether you're a parent or not, the dad bod is a real thing, and we just hold on to it here. And it's stubborn fat. I've been working out for years and have not been able to get this down. It's a great option to slim the waistline.
And this idea of looks maxing, have you heard of that? Because we've been talking about it a little bit.
Now, looks maxing in the sense of aesthetically how much you can do to get perfect and refined. I think, you know, what we all need to do is be realistic with our body goals. What we see in the media and we see on social media, celebrities, it's not always achievable. And some of the models being shown to us on Instagram and TV, it's AI.
Yep.
So what's the real expectation?
All over.
Yeah.
That's so true.
Yeah,
And
so-
I always say too, when I see like the J-Los and the Halle Berrys of the world, I'm like, I could look like that too if I had that money.
yeah.
You know?
Yeah.
So I do fine with my
Yeah.
exactly the access and
Yeah.
the money that it
Yeah.
takes.
I think-
But great options here, just
Yeah.
locally.
We got to be more in line with looks optimizing rather than looks maxing. Let's be as good as we can be and not try to hold ourselves to the standard of necessarily a model on social media, you know?
I like it.
Yeah.
All right. Dr. Beauty Blade, thank you so much for coming by. You can find all things plastic surgery and what Dr. Beauty Blade is up to on Instagram at Dr. Beauty Blade.